Okay, we're going to talk about carpal tunnel syndrome, median nerve, mobilization. First of all, we're going to do some soft tissue work for the carpal tunnel stuff. We're going to start, though, proximal, like we always do. We always start proximally, so we're always thinking about the nerve roots coming off C5 to T1. And in this case, the median nerve is going to come down between the biceps here, right in all the way in through the transverse carpal ligament or the palmar aponeurosis, down to the palmar aponeurosis. And we're going to be showing you a couple of carpal tunnel techniques, but we have a lot of videos that show carpal tunnel, so I'm not going to get into a lot of them. I'm just going to basically show you the landmarks to help spread that flexor retinaculum or transverse carpal ligament, whatever you want to call it. First of all, we're going to start proximally, as we always do, and we're going to just work the biceps. We're just going to mobilize the biceps by pushing away and pulling toward us, spreading biceps brachii from brachialis. Just a little bit of warming up of that tissue to get that median nerve feeling groovy. We can come in and do some of the, notice how I've got the middle finger, because what is a dermatome that the median nerve is going to go down? It's going to come down into the thumb, index finger, and middle finger primarily. So that's what we're going to want to stretch. So as I come in here, and even though I'm thinking soft tissue, I'm stretching up biceps, I'm still keeping that hand into extension so that I can stretch that a little bit of ulnar deviation too, as I can stretch that, that tissue. We want to make sure that we have nice movement through the elbow. We've already mobilized the joints of the elbow, and we would just want to make sure that it can glide through there. So we're going to do a sling and resist technique here to make sure that we have some motion through the forearm flexors. And for the carpal tunnel, it'll come down through the transverse carpal ligaments. The most important thing is we want to know where the bones that attach to the transverse carpal ligament, that we're going to want to spread those bones. You don't want to get in here where they're hurting on the where the median nerve and the flexor tendons that are swollen, crowding out the median nerve, causing pain. We don't want to get in that area, do we? So we're going to come up here on the pisiform, the little bitty bone that moves in there. You can find it in your own hand. It's a movable bone. There's only one muscle that it connects to that. Flexor carpi ulnaris. One single muscle attaches to the pisiform or pisiform, however you want to say it. And then the hamate, the hook of the hamate, why it's got a hook is because of that transverse carpal ligament. So those two on one side, and that you got the scaphoid and trapezium on the other side, the attachment sites for the transverse carpal ligament. So there's where you're going to want to spread. So you're going to come in like this, and I'm going to kind of just get these bones moving like that, making sure notice how I'm putting the wrist into the extension. So without I'm not going to put the hands in extension because that hurts them. But I can put the wrist in extension because I'm mobilizing the proximal carpal row. Look at those carpals. So here we go. So I'm going to spread it like that, and then I'm going to ask Dina to extend her fingers. Open it up completely. Perfect. Good, good. And back. And open again. And back. And open it up again. Good. And back. Now I'm going to move into the palmar aponeurosis. Still not into I'm through the bed here. Here's where the pain's coming from, right in here. I'm through there. So now I'm in the palmar aponeurosis. So open up. Moving it out. Close. And moving it out. You can come in either way, either direction. Work it however you want. Main thing is to make sure you've got all these flexor muscles working independently, and you don't have any protective muscle guarding in here from these nerve problems.